Hello everyone. Today we will discuss about the antidote which are used in different drug overdose or in the drug toxicity. These are the high yield topic for FMGE, NEET PG and INI-CET exam, and these are frequently asked in all these exam. If you are coming to my channel for the first time, then subscribe my channel for more such exam related content. So let us begin with the different antidote which are used in different drug overdose. What is the antidote for paracetamol overdose? So the antidote for paracetamol overdose is N-acetylcysteine, which is also known as NAC. Flumazenil is not used in paracetamol overdose. Atropine is anticholinergic drug, so this is also not correct option. Naloxone is used in opioid poisoning. So the correct answer here is N-acetylcysteine. Now this N-acetylcysteine, it will restore the glutathione store in the liver, as well as it decreases the NAPQI1, that is the toxic metabolite which causes hepatotoxicity. So remember, Rumac Matthew nomogram, this you have to plot 4 hours post ingestion to decide if the therapy is needed or not. And this can be asked in the form of MCQ. So you have to remember, in paracetamol overdose, Rumac Matthew nomogram you have to plot. Now next MCQ, what is the antidote for methanol poisoning? Fomepizole, flumazenil, atropine, naloxone. So answer here is a fomepizole. Now fomepizole will competitively inhibit with the aldehyde dehydrogenase, and it will decrease the generation of formic acid which is formed from the methanol. Now if the fomepizole is not given in the option, then the another second based option is ethanol. So that is also correct answer. Now next MCQ, a patient presented with the pinpoint pupils, hypotension and respiratory depression. What is the drug of choice for this opioid poisoning? Fomepizole, flumazenil, disulfiram and naloxone. So remember, for opioid poisoning, the antidote is naloxone. So answer here is naloxone. Remember, in opioid poisoning, the characteristic which is given is a pinpoint pupil, hypotension and respiratory depression. So now in this MCQ, the diagnosis is already given that this is the case of opioid poisoning. But if it is not given, then these are the characteristic signs, pinpoint pupils and respiratory depression, which indicate this is the case of opioid poisoning, and the answer will be always naloxone. Now next MCQ, a patient presented with the pinpoint pupils, respiratory depression, excessive salivation, lacrimation, sweating and bronchospasm after pesticide exposure. What is the drug of choice for organophosphate poisoning? Here the diagnosis is given organophosphate poisoning, and for this the drug is atropine. Fomepizole, propranolol, naloxone, these are the wrong options. Now suppose if the organophosphate poisoning diagnosis is not given, then you can easily judge that this is the organophosphate poisoning from the symptoms only, and that you have to remember these are the pinpoint pupils, respiratory depression along with the increased secretions like excessive salivation, lacrimation, sweating. All these are indicative of organophosphate poisoning, and the drug will be always atropine, or the another drug is a pralidoxime that acts by reactivating the acetylcholine esterase enzyme. So for organophosphate poisoning, atropine will block the muscarinic receptors and it will mask all the symptoms which is caused by muscarinic receptor stimulation. So atropine will be drug of choice in that case, and if atropine is not given and pralidoxime is given, then pralidoxime will regenerate the acetylcholine esterase enzyme. So for organophosphate poisoning, you have to look for these two drugs, atropine and pralidoxime, in the options. Here in this MCQ, pralidoxime is not given, so answer is atropine. Now coming to the another MCQ, what is the drug of choice for diazepam overdose? Diazepam belongs to benzodiazepine group, and the drug of choice for benzodiazepine poisoning is flumazenil. So these you have to remember that flumazenil is a drug of choice for benzodiazepine overdose. Other options, fomepizole, disulfiram and naloxone, these are not correct. Now next MCQ, what is the drug of choice for digoxin toxicity? Verapamil, diazepam, disulfiram, naloxone. So remember, for digoxin toxicity, the orphan drug that is given, it is diazepam. So answer here is diazepam. Now next MCQ, what is the drug of choice for heparin toxicity? Protamine, diazepam, disulfiram and vitamin K. So heparin will cause bleeding, and for that the drug of choice is protamine. So that is the correct answer here. Protamine is the correct answer here. Diazepam is used in digoxin toxicity. Disulfiram is used in alcohol aversion therapy. vitamin K is used in the warfarin toxicity. So here the answer is protamine. I have already uploaded the video about the heparin and the link for that is in the description box. Next MCQ is, what is the drug of choice for warfarin toxicity? Protamine, dizibine, disulfiram and vitamin K. So the answer is vitamin K. Now if vitamin K is not given in the option, then the other answer which is correct is prothrombin complex concentrate. So for warfarin toxicity, you can give either vitamin K or prothrombin complex concentrate. Detailed video about the warfarin I have already uploaded and the link for that is in the description box. Key differences between the heparin and warfarin, that video already I have uploaded and the link for that is in the description box. Now coming to the next MCQ, what is the drug of choice for acute iron toxicity? Protamine, digibine, disulfiram and deferoxamine. So remember, iron means ferrous. So in deferoxamine, there is a ferro in its name. So the answer here is a deferoxamine and that is used in acute iron toxicity. Now another drug is deferasirox and that is used for chronic iron toxicity. So these two drugs you have to remember that is used in iron toxicity. Protamine is used in heparin toxicity, digibine is used in digoxin toxicity and disulfiram is used in alcohol aversion therapy. So correct option here is a deferoxamine. Next MCQ, what is the antidote for copper toxicity also known as Wilson's disease? BAL, deferasirox, penicillamine and deferoxamine. So answer here is a penicillamine and that you can remember with the help of very easy trick and that is penny for the copper. So this is the mnemonic you can easily remember. Copper toxicity, you can treat it with the help of the penicillamine. Now similarly, heavy metal that can be also asked in MCQ, this include lead poisoning, arsenic and mercury poisoning. For all these, the drug of choice is succimer or BAL, which is also known as dimercaprol. So for all this you have to remember that BAL or succimer or dimercaprol. Now this is the easy question that you have to solve. What is the primary antidote used for acute cyanide poisoning? What is the correct answer that you can comment in the comment box. If you like this video, then subscribe my channel to follow for more such pharmacology related videos. Thank you.